Have you heard of the concept of food? F-O-O-D. And no, I'm not talking about the food that we eat. I'm actually talking about something called as fetal origin of adult onset diseases. This is Dr. Santoshi Nandigam. I'm a consultant obstetrician and gynecologist in Cadence Hospitals, Nungambakkam, Chennai. Today, I'm going to discuss about something called as FOOD, that is fetal origin of adult onset diseases. So have you ever wondered why someone becomes a diabetic or why someone becomes a hypertensive at their 35s or 40 years of age? Is there any connection between the fetal life of that particular person to the adult onset of diseases? Well, there's a lot of research which has gone into understanding this concept of fetal origin of adult diseases. So let me tell you a story now. So apparently, scientists have tried doing a lot of research on pregnant women who were exposed to famine in World War II. So they have followed up on their babies to up to 30 years, 35 years, and have found out that these children, which were born to pregnant women exposed to a lot of famine during the World War II, have really bad altered sugars in their body at their 30s or 40s of age. So this altered metabolism of sugar is something they are relating it to the exposure to famine in the pregnant women during their pregnancy. So what I'm trying to tell you is there is a definite connection between the environment in the womb that the baby is exposed to and how they lead their life in the future, how their body deals with mechanisms of sugar metabolism, just as an example, in the future. So a lot of scientists have validated this research and concluded that there are different systems in the body which is completely dependent on the intrauterine environment. For example, the cardiovascular system. The baby's potential to become a hypertensive at their 40 or 45 years of age is definitely dependent on the environment, the womb environment that the baby is exposed to in the pregnancy. Number two, the endocrine system. Endocrine system, we are seeing a lot of increase in diabetes in the current generation, and we are seeing a lot of young people coming up or becoming pre-diabetic or diabetic in their 28s, 30s, 32s, so on and so forth. So not just that, not just diabetes, we have thyroid issues, we have PCOS issues, polycystic ovarian syndrome, which is literally on the rise now. 1 in 4 women are polycystic, that is, they have cysts in the ovaries, smaller cysts in the ovaries, and altered metabolism, altered sugars, and so on. Number 3, the skeletal system, the bone mineral density. The density of the bones is also dependent on the nutrients that the mother gives the baby while in the womb. Number 4, digestive system. Now, we are seeing a lot of people having a lot of food allergies and, their inability to metabolize cholesterol properly, and that is also resulting in sudden cardiac arrests in young women or young men for that matter. So for the last 2-3 years, we've been seeing so many young people in their late 40s, early 50s passing away with sudden cardiac arrest. And, it's kind of attributable to the cholesterol metabolism. And yes, the scientists have also found out that this reprogramming of metabolism has a fetal origin. Number 5, immune system. So there is also a generalized increase in allergies in the general population, and these allergies, especially if you notice people living in US, they are allergic to pollen, they're allergic to peanuts, they're allergic to every single thing that's common around. So why are these allergies coming? Why is there a generalized increase in the allergies? Is because of the reprogramming that's happening when the baby is in utero. Well, how does this food happen? Why is the concept of FOOD coming at all? Why should it be there? It's a very simple concept. We always crave for something which we don't have. We always tend to lean towards something which we need but don't have. Now, let's say the mother is exposed to really less nutritious food in the pregnancy, the baby tends to go through a reprogramming inside the uterus. The baby's body tends to, gets itself used to the constant non-availability of nutrients. So once after the baby is born, when the outside environment is changed, so what happens is that there is a metabolic reprogramming which already happened when the baby is inside the uterus, which leads to excessive storage of fat and abnormal insulin metabolism. So this leads to adult obesity and an n number of problems that come along with obesity. So we have to blame the fetal brain for all of this. So fetal brain takes the first priority in acquiring nutrients. So when it is deprived of nutrients, when the mother is not providing enough nutrients to the baby while pregnant, the brain derives its nutrients from other organs. So the first organ that gets affected is the liver. Liver is a very, very, very important organ because it metabolizes everything that we eat. It kind of derives our metabolism associated with the different foods that we eat, the insulin, and so many other things. So when the brain gets its required nutrients from the liver gets reprogrammed. So once the liver reprogramming happens, the baby's mechanism or the capability of processing kind of decreases. So this reprogramming is what increases the risk of eventually becoming a diabetic or a hypertensive or obese individual in the future. So this is the concept of FOOD, or fetal origin of adult onset diseases. For more information and updates, subscribe to my YouTube channel.